Hey everyone, and welcome back to the channel. Today, we're talking about something that could directly impact your wallet and your health coverage. Major new changes to the Affordable Care Act, officially finalized by the Centers for Medicare and Medicaid Services under the Trump administration. If you're an American citizen relying on the health insurance marketplace, or even just a taxpayer, this affects you directly. So let's get straight to what you need to know, because these updates are significant. The administration's central claim is that these new policies, part of what they call the 2025 Marketplace Integrity and Affordability Final Rule, will reduce spending and dramatically lower individual health insurance premiums by about 5% on average, they project. This isn't just about premiums, though. They're also aiming to save taxpayers up to $12 billion in 2026 alone, primarily by addressing what they describe as a surge of improper enrollments within the ACA exchanges. The stated goal is to restore integrity to these markets, strengthen accountability, and ensure that taxpayer dollars are used only for those who are truly eligible, combating what they claim could be billions in wasteful spending. U.S. Health and Human Services Secretary Robert F. Kennedy Jr. stated, quote, "We are strengthening health insurance markets for American families and protecting taxpayer dollars from waste, fraud, and abuse." He added, quote, "With this rule, we're lowering marketplace premiums, expanding coverage for families, and ensuring that illegal aliens do not receive taxpayer-funded health insurance." CMS Administrator Dr. Mehmet Oz echoed this sentiment, asserting that CMS is restoring integrity to ACA exchanges by cracking down on fraud, protecting American taxpayer dollars, and ensuring coverage is there for those who truly need it, adding that it's about putting patients first, stopping exploitation of the system, and realigning the program with the values of personal responsibility and fiscal discipline. The agency even estimates that as many as 5 million people may have been improperly enrolled in ACA plans just last year, costing taxpayers upwards of $20 billion. Citing data from the Paragon Health Institute, they claim these improper enrollments were enabled by weakened verification processes and expanded premium subsidies. So, what are the specifics of this new rule? First off, the annual open enrollment period is getting shorter. For the 2027 plan year, it will standardize to end by December 31st for all health insurance exchanges, a notable shift from the previous mid-January deadline. Specifically, the federal marketplace will see its enrollment period shortened from November 1 to January 15th to November 1 to December 15th, starting in 2027. State exchanges will have the flexibility to determine their specific open enrollment dates between November 1 and December 31st, as long as the enrollment period does not exceed 9 weeks. This means less time to enroll if you're not paying close attention. Beyond that, the rule repeals the monthly special enrollment period for individuals whose household incomes are at or below 150% of the federal poverty level. The administration argues these windows were sometimes exploited by brokers and agents to improperly enroll people or switch them to different plans to secure higher commissions. You can also expect stricter income verifications for individuals who receive premium subsidies and more rigorous eligibility checks for anyone signing up during special enrollment periods. Another significant change impacts those who are automatically re-enrolled in fully subsidized plans. Starting in the 2026 plan year, if you're auto re-enrolled without a new eligibility verification, you will see your advance premium tax credit payments reduced by $5 a month, essentially resulting in a small monthly premium. This is designed to encourage consumers to actively engage with their health coverage, ensuring they are aware of and engaged in their health coverage. If an individual files the necessary paperwork showing they are still eligible for a no premium plan, they will be re-enrolled in one. A particularly impactful provision is the reinstatement of the 2012 interpretation of lawfully present, which excludes deferred action for childhood arrivals, or DACA recipients, from eligibility for ACA exchange coverage and basic health program coverage in states that choose to operate a BHP. This exclusion also applies to advanced premium tax credits, and cost-sharing reductions. This move undoes a prior policy that was estimated to allow over 147,000 immigrants to obtain healthcare coverage. Additionally, the new rule prohibits federal subsidies from being used to cover the cost of certain specified sex trait modification procedures, specifically those to align an individual's physical appearance or body with an asserted identity that differs from the individual's sex. Now, while the administration highlights these changes as steps towards fiscal responsibility and market integrity, there's a flip side with significant concerns. Critics, including health policy experts and major organizations like the American Hospital Association, project that between between 725,000 to 2 million consumers could lose their coverage as a direct result of these provisions. Some estimates go as high as 1.8 million people. The AHA specifically voiced concerns to CMS in April after the rule was proposed, stating that coverage loss of this magnitude would have substantial consequences for patient access to care, as well as the financial stability of hospitals, health systems, and other providers, as written in a letter by Ashley Thompson, SVP Public Policy Analysis and Development with AHA to CMS Administrator Dr. Mehmet Oz. The AHA had even encouraged CMS to pause finalizing many of the proposals to give stakeholders additional time to consider the impacts. Experts also point out that a shorter enrollment period and more complex income verification could lead to many eligible individuals simply falling through the cracks. Larry Levitt, Executive Vice President for Health Policy at KFF and former health policy advisor to President Bill Clinton, stated that the combination of these factors will result in more people falling through the cracks. He also noted that making enrollment less consumer-friendly will cause people to miss out on subsidized health insurance and increase the uninsured rate. Concerns have also been raised that making it harder to access preventative care will ultimately lead to more reliance on emergency rooms, creating greater strain on our healthcare system. Seidel Barreto, the policy manager of the National Asian Pacific American Women's Forum, NAPAWF, predicted that DACA access would likely be revoked and explained the consequences. If folks don't have access to healthcare, that means they're probably not going to seek preventative care. If something comes up, they're having symptoms, they'll let things get worse. Then they're going to need to go to the emergency room. Overburdening our emergency care system is definitely not a good thing, and it's always better for both patients and providers when people are able to access preventative and routine care. It's important to remember that the ACA currently provides coverage to roughly 45 million Americans, either through individual health plan marketplaces or expanded Medicaid coverage. In January, about 24 million people had already signed up for Obamacare coverage for 2025. It's also worth noting that some of these policies are temporary, set to sunset at the end of the 2026 plan year. This temporary nature is reportedly designed to give lawmakers on Capitol Hill an opportunity to codify these provisions into permanent law, using the projected savings to help fund other legislative priorities. For example, the House last month included some of these changes in its version of President Donald Trump's mega bill, which aims to extend Trump's 2017 tax cuts, but needs budget savings to do it. The Senate has not yet voted on its version of the bill. The temporary nature is also intended to give the agency time to ensure that the enhanced eligibility checks are working efficiently. This is not the first effort by the Trump administration to limit access to ACA coverage. Earlier this year, funding for the Obamacare Navigator program, which helped enroll and educate people about ACA coverage, was slashed by $360 million over the next 4 years. The bottom line here is that the landscape of health insurance through the ACH changes is shifting, and it's vital to stay informed about how these changes could impact your family's coverage and financial planning. Make sure you understand the new deadlines and verification requirements. Thanks for tuning in. I hope this overview helps you navigate these important changes. If you found this information valuable, please hit that like button, subscribe for more insights, and I'll catch you in the next video.